Hello, this is Cameron Sabat from Cutting to the Case, and today I'm here with Dr. Jack Weick. And Dr. Jack Weick is an orthopedic trauma surgeon at Grant Medical Center in Columbus, Ohio. He trained at U Chicago, Michigan, and UT Houston. His research focuses on infection, geriatric trauma, and value-based care. He's passionate about mentorship, surgical education, and improving outcomes in complex orthopedic trauma patients. Thank you very much for joining us today.
Yeah, thanks for having me.
Thank you. So really, I want to start out with you trained at these amazing, U Chicago, Michigan, and completed your trauma fellowship at UT Houston. How did each of those programs shape your identity as a surgeon?
Yeah, I think the big thing for me was having good mentors, faculty along the way that kind of help steer you in the right direction. As you know, when you're kind of going through the process, you don't exactly know what you want to do or what you want to become, but you kind of are exposed to different things. And I think I had, the blessings or the opportunities to have great mentors that could kind of help answer my questions. People I could just kind of look up to or kind of see what their life was like or what their career was like, and kind of shape my own career, whether it was to be like them or not to be like them. That was part of the reason why I picked the different places I went to is just having great mentors, great people around me. I think it really goes a long way.
And in addition to Houston being a huge, huge place for trauma,
Yeah.
what specifically drew you to orthopedic trauma? And was there like a defining moment that solidified that path for you?
Yeah, I wouldn't say there was one moment. I always really liked it ever since I started residency. It was actually my first rotation as an intern was on orthopedic trauma, and I really liked it. I just never really wanted to pull the trigger, so to speak, because, obviously it's a little bit different than other subspecialties within orthopedics. I also really like joint arthroplasty, shoulder, things like that. And then finally, after it was probably towards the end of my third year, actually. I was kind of talking to my wife about it, and she was just kind of like, you should probably just do trauma. You seem to like that the most. And I was like, yeah, you're probably right. I decided somewhat late relative to other people, I think. And, I think I just really like being able to operate all over the body. You kind of see patients on most of the time the worst day of their lives, and then you get the opportunity to fix them, make them better, and see them walk in when you see them back in clinic down the road. So it's pretty special. It's I don't take it lightly, and it's an outstanding field, and so yeah.
Yeah, absolutely. And from there, your career blossomed. You've published across JBJS, JAOS, and JOT, and also served as a reviewer for multiple journals. How has your academic involvement shaped your clinical decision making?
Yeah, I'd say, certainly every step of the way I've been involved in research. Again, that was partly due to good mentors I had who were able to get me involved in different projects or kind of show me, the importance of research and how it can, not only impact your own career, but hopefully improve the field. It certainly was a bigger part of my coming up in residency and everything. But now I'm fortunate I have more of an opportunity to kind of pick and choose what is really interesting to me and questions I really have. Or fortunately too, I'm in a position now where I have, residents or med students that have interesting questions and they just need, a faculty member to help them, steer them in the right direction or look at things that they're thinking of or writing up. And so that's kind of neat too to see that side of things now.
Yeah, you get to see it from both sides now.
Yeah.
Fascinating.
Yeah.
And you've mentored these students, residents, and early career surgeons. What's one lesson that you emphasize in every teaching interaction?
Yeah, that's a good question. I would say just always, stay hungry, so to speak. I think the residents I work with here, it's really special because they all have a passion. They want to learn, and it's a lot of fun for me when I'm around people who want to be there and want to learn and want to see different things. And so I think as long as you're staying engaged, being present, and staying hungry, so to speak, you're gonna, really go a long way.
Absolutely. And then hunger travels far in especially trauma surgery, I'm sure.
Yeah.
In the field, unpredictability is the norm. How do you maintain control and clarity in those high stakes, chaotic operative situations?
Yeah, I think it's just you just kind of have to take a step back. You can't be the loudest, most chaotic person in the room. You just kind of have to be the calm, level-headed voice. Take a step back. You don't have to make any quick rash decisions most of the time, and fortunately, you get to see a lot of different things in your training. And so most of the stuff you'll come across, you've seen before, you've seen a mentor do it before. And so you can have a good idea of how to approach different situations. But I think just kind of being calm, never getting too high or too low kind of really goes a long way to helping these people.
Yes, yes, absolutely. And your research now spans a similarly kind of broad spectrum of Latin orthopedics, from infection to geriatric trauma to value-based care. Where do you believe the most transformative progress in trauma outcomes will come in the next decade?
Yeah, that's a great question. So I think it's interesting because we always talk about this at our journal clubs. Trauma studies are hard because these patients they're very different. It's different than, not to pick on the joint surgeons, but joint surgeons can easily get 20,000 people that all kind of look the same because they're doing all the same surgeries on them. Trauma is different because every fracture is a little bit different. Every patient's very different. So it's hard to get good studies. So I think, we're certainly not there in terms of perfecting our surgical techniques, but we're getting better at it. But now where the arthroplasty surgeons have, taken a step ahead is they've really now begun to optimize, pain control, both pre and post operatively, infection control, things like that, where I think now trauma is starting to, there's been a lot of pushes recently on the infection front and ways to minimize that. And I think similar with pain, we kind of ignore pain because we expect our trauma patients, unfortunately, to have pain. And so we kind of ignore it, for lack of better terms. But I think we can kind of learn some lessons from our arthroplasty colleagues on how they've, not to say perfected that, but they've gotten really good at it. And they can do these big major surgeries as outpatients now, and people go home pretty comfortable. And so I think we have a lot to learn from them about that.
Yeah, and I recall you mentioning this at the club with the Mount Carmel residency program director. You were discussing how trauma has a little ways to go and things to learn
Yeah.
from the arthroplasty folks.
Yep, absolutely.
Yeah, yeah. So moving forward, just a final question. What advice do you have for our audience, who's mainly comprised of medical students and residents, trainees?
Yeah, no, I think, it's a long road. It's certainly when you're in the middle of it, it feels really long, but it's very stereotypical. You now say as you're going through it, though, once you get done with it, it's like, wow, it goes by quickly. And so take advantage of every opportunity you're given. Obviously you got to have balance in your life, but at the same time, you got to kind of take advantage of these opportunities and don't really want to say no to a lot of these opportunities. And you just want to be present and be there because that's the only way you're going to learn. That's the only way people are going to kind of notice you and you're going to move forward that way. So it's a hard process. It's a long, long road for sure, but it's definitely rewarding and it's certainly is worth, once you get the opportunity to take care of patients and improve their lives.
Yeah, yeah. No, and that's something very similar that Dr. William Postma, chief of sports surgery at Georgetown, said on this podcast. He said almost the same thing, which is always say yes early in your career.
Yeah.
Yeah, certainly seems to be fantastic advice. I appreciate your time. Thank you very much.
Yeah, of course.
And yeah, this has been Cutting to the Case. This is Cameron Sabat signing off. And